Good afternoon, and thank you for joining us for today's virtual media briefing on COVID-19 in London and Middlesex County. Today, we are joined by London Mayor Ed Holder and by the Associate Medical Officer of Health for the Middlesex-London Health Unit, Dr. Alex Summers. As always, we welcome the media in attendance and remind them to submit their questions in the question forum here on Microsoft Teams, and we will get to your questions during the briefing. Please indicate your media outlet and your name. We'd also like to welcome the viewers who are tuning in on Rogers Television this afternoon, as well as those on the Rogers Facebook page and Rogers YouTube channel. Also, welcome to those listening on Global News Radio, AM 980 CFPL, and those tuning in on the CTV London website. We'll get to the opening statements, and we'll start with London Mayor Ed Holder. Mayor Holder.
Well, thank you, Dan, and good afternoon, everyone. So today I'm very much looking forward to a conversation that will include myself with Deputy Mayor Helmer and a broad cross-section of London bar and restaurant owners. We also know a number of councillors participate in these forums, as well as senior levels of government. As you know, based on new provincial orders issued yesterday, it'll be at least now June 9th, and possibly longer before these establishments are truly allowed to reopen. We know the bar and restaurant sector has been uniquely impacted by this pandemic, and once they're allowed to reopen, I know they'll be operating in a dramatically different manner. So that's really the purpose of the conversation that will be taking place this afternoon. We want to hear from as many bar and restaurant owners as possible. How have they been coping? How do they see their businesses returning, especially in the short term? And what, if anything, can the city do to assist? These businesses are significant employers and local landmarks in their respective neighborhoods. They're gathering places for families and friends, and they support so many community initiatives, from charities to youth sports and more. Both the Deputy Mayor and I, along with other members of council, are eager to learn and to assist where it makes sense. In the meantime, as I've said in this press conference before, all of us can help local bars and restaurants by doing curbside pickup when possible, or taking advantage of the restaurants and bars' own delivery systems instead of relying on some of the more popular apps. When every last dollar counts, some of these apps take cuts of as much as 30%, money that could and should instead be going to local restaurants. So let's support them just as how they have supported us. Now, quickly on the issue of local transit. Two days ago, the CEO of the London Transit Commission gave testimony to the Federal Finance Committee regarding the challenging state of affairs in operating public transit during this pandemic. The LTC voted yesterday to extend free fare transit by having passengers board from the back doors until at least the end of June. We've also heard yet again how much this is costing the LTC. By mid-June, the Commission will have emptied 2 separate reserve accounts, and they'll be out of cash. They don't have the money, and neither does the city. I've said countless times, even after a series of cost-cutting measures and layoffs, that we as a city are looking at some $33 million hole by the end of August. Myself, including other mayors across Canada, have been telling other levels of government for more than 4 weeks now that we're absolutely in need of emergency government operating funding to maintain essential services. And let me be clear, while the situation with LTC is dire, and frankly, will be on life support, it's not the only service that may be impacted. We're getting to the point now that without immediate assistance from the provincial and federal governments, we're going to need to make some additional difficult and extremely painful choices. Look, I hope it doesn't come to that, but we can only make our case so many times. And in addition to funds, time now becomes the enemy, and it's running desperately short. On that note, Dr. Summers.
Thank you, Mr. Mayor, and thank you to those tuning in today. I'd like to provide you with an update on the COVID-19 situation here in the Middlesex-London region. We have reported 512 cases as of today. We continue to see 3 to 5 cases reported daily. There are days when this is less, there are days with this and more, but we continue to see these cases roll in. What we continue to look for is the true flattening of the curve, which would be 0 cases on a routine basis for an extended period of time. We're not yet in that position, but we continue to work towards that. We continue to have outbreaks in long-term care facilities and retirement homes. However, the frequency of those outbreaks has decreased, and we're in a position where a number of those outbreaks will be declared over within the next week. One of the things I wanted to comment on was the changing in testing availability over the last week. As many of you know, the Premier indicated over the weekend that testing would be available for those that wished it, whether they had symptoms or not. We continue to emphasize that people who have symptoms of COVID-19 should get tested and speak to their healthcare provider or visit one of the assessment centers. The assessment centers are open at Carling Heights Optimist Center as well as at Oak Ridge Arena. We are now, as a health unit, posting the wait times for those facilities, and we'll be continuing to do so daily over the foreseeable future. I do want to take a bit of a time to highlight what a test result means for someone. When somebody has symptoms of COVID-19, it's very important that they are tested so that if they are positive for COVID-19, they can quickly self-isolate and MLHU can work with them to identify close contacts and to quarantine those contacts. For individuals that are asymptomatic, we want to make sure that people recognize that a negative test result is only relevant on the day that you get it done. It does not mean that because you've tested negative today, that you're able to go and do whatever you so choose with regards to ignoring physical distancing interventions. A negative test is only relevant the day that it happens, but it does not mean that physical distancing, hand hygiene, and continuing to play your part in preventing the transmission of COVID-19 in our community goes out the window. So for everyone who is eager to get a test, I understand that absolutely, and you would not be turned away from the assessment center. But a negative test result is only relevant today and does not mean that the behaviors that have been so critical in stopping the transmission of COVID-19 in our community should stop. And so we really hope that people take that to heart as they go into the next weekend. And certainly physical distancing remains a critical part of our response as we continue to see cases roll in. Thanks again for the opportunity to speak with you today, and certainly check out our website for the ongoing numbers, both with regards to the cases that are reported in, as well as to the wait times at the assessment center. Back to you, Dan. Thank you.
Well, thank you very much, Dr. Summers. And just to reiterate those points that Dr. Summers made about the wait times, at the assessment centers at both Carling Heights Optimist Center and at Oak Ridge Arena, those will be updated daily at 11:50, at 1:50, and at 3:50 and at 4:50, I believe. So check that out on Twitter at ML Health Unit for those times and for a sense of how long the waits are at the assessment centers. All right, we do have some questions, so let's get to those right away. Mayor Holder, the first one is for you. It's from Steve Young at CTV London. Mayor Holder, do you find it frustrating when Londoners appear to be following social distancing measures? We've seen the number of cases are very low locally. However, it appears the opening of the province is slowed by what is happening in larger centers like Toronto.
Well, first, Steve, let me say that as the provincial numbers are higher, that absolutely limits the province's ability to show flexibility to the regions who have frankly done it the right way and have been able to have good results. So when you see large crowds in another jurisdiction, as was evidenced last weekend, not at all helpful. In the main in London, citizens have been great. They understand the direction as pointed out by the medical officer of health and the health unit and the team, and by what we as a council have been saying about self-distancing, about crowds, about hygiene. And that message, for the most part, has gotten through. The evidence to that, to me, is in the very first week when we went beyond education and went through bylaw enforcement and effectively issued tickets. We had some 32 tickets over a weekend that were issued. That has been dramatically reduced, even to the point where last weekend there were some warnings, some 60 warnings, but we had no tickets issued. And people were very supportive once they were confronted by law enforcement folks and reminded that, in fact, this is not a healthy state. But am I concerned if people ignore this issue, or if somehow regionally we open up the gates and allow other jurisdictions to come into this community where their numbers are not at all good? I'm nervous about that. We have no border points. People can come in freely, but I don't think we should be encouraging it at this time. And in fact, the whole issue of the regional flexibility is not yet has not yet caught fully the flexible attention of the Premier on this. So I'm saying to you that right now I'm optimistic that Londoners will maintain their vigilance, because the sacrifice we've asked people to make over the last 2.5 months has been so clearly heard. We don't want to go through this again. We know there's talks of second waves and all, and I think that could have huge impact. But let's mitigate it as much as we can. So today, I'm encouraging Londoners to continue the self-distancing and the crowd limits of no more than 5, and maintain the hygiene. We'll get through this together.
All right, thank you, Mayor Holder. A follow-up question from Steve Young for you, Mr. Mayor. You mentioned LTC is on life support. What other municipal services find themselves in similar situations?
Well, when you find yourself as a municipality, when by our best numbers, we have saved through some staff reductions, major staff reductions, not just some, and also limitations around services, we have saved some $24 million in expenses. And yet at the same time, by the end of June, we will find ourselves in debt $23 million and $35 million almost by the end of August. Tell me what service won't be impacted. All I need to suggest to you, when I look at my good friend John Tory and some of the things he's talking in terms of, he's talking about concerns around shelter spaces and long-term care limitations, certainly transit, other frontline services, childcare subsidies. He's gone through a whole list of things. We are going through and putting together those same numbers so that Londoners can understand what the issue is. So what we're encouraging people to do is to contact our senior levels of government, who, by the way, in very specific areas have been tremendous. The way they've helped students, the way they've helped seniors, the way that they've helped small business and larger business. And even then, there are lots of gaps in there, but I give senior levels of government credit for that. The challenge is, though, the municipal governments across this country, who are the front line and the bottom line, have somehow been ignored in this process, and they have to step up. I believe they're talking. I think they're trying to find the right arrangement, but we are desperate. And if the issue of LTC is dire, let me tell you how significant it is on the city, who will do their best to support that essential service as well.
All right, thank you very much, Mr. Mayor. The next question, Dr. Summers, is for you. It comes from Grant Demi at My FM Radio in Strathroy. Dr. Summers, are you concerned that there may be a false sense of security among Middlesex-London residents, given that our local region has been regularly reporting low case figures for a few weeks?
Thank you for that question. I certainly would want to take every opportunity to emphasize that despite our low numbers, they continue to be numbers. In other words, we haven't hit the 0 cases on a daily basis for an extended period of time that we need to hit to be confident that we do not have community transmission in the Middlesex and London region. We continue to have community transmission, and so that's why the message to those in Middlesex and London is quite simple: stay the course, keep the distance. It's really critical that we maintain those physical distancing measures as we see numbers continue to happen. As we should, we celebrate the success that we've had. Our numbers are low, however, they are persistent, and it's that persistent nature that we need to address moving forward. And so I hope that people continue to recognize the urgency of our actions so that we can get to a place where we can open things up, so that we can feel comfortable in returning to the way of life that we would wish to have for those in Middlesex and London. So do I have concern? I know that Londoners and those in Middlesex County have stepped up to the plate thus far and continue to step up to the plate. And so I'm confident that as they understand the significance of the persistence of these numbers, they'll continue to do what they need to do to protect this community.
All right, thank you very much, Dr. Summers. Gentlemen, that actually brings us to the end of the questions that we have received from the media today. Before we go, though, I do want to clarify, I know off the top I mentioned the times that we would be posting the updates to Twitter around the wait times at the Carling Heights Optimus Community Center and Oak Ridge Arena Assessment Centers. And I want to go over those times one more time: 10:50, 12:50, 2:50, and 4:50 in the afternoon. And you can find that on ML Health Unit on Twitter. And to our friends in the media, we would appreciate it if you're able to share those wait times with your listeners, so that we can ensure that people who do want to use the assessment centers and are interested in pursuing getting testing can do so in the most efficient way possible. Well, that brings us to the end of today's virtual media briefing. We'd like to thank you for tuning in, and we'll see you again tomorrow on Friday with Dr. Summers and Mayor Holder again on our next virtual media briefing. Have a great rest of the day.